Imagine a person who has just been diagnosed with colorectal cancer. The doctor tells him it's stage 2. This is actually good news. Stage 2 is early in cancer progression and has a 90% survival rate. The patient will need surgery to remove the tumor, but like most stage 2 patients, he will not need any chemotherapy. The patient is relieved. Chemotherapy would mean months of very toxic side effects. Unfortunately, what this person doesn't know is that in 30% of stage 2 colorectal cancer patients, the cancer returns at a later date. These patients do need chemotherapy to treat this recurrence, and timing is crucial. The earlier the patient receives chemotherapy, the better their chances of survival. So how do we distinguish this subset of patients while protecting the other 70% of patients from the harsh side effects of chemotherapy? Well, that's where my research comes in. Using actual patient data, I divided people into 2 groups, those that had a recurrence and those that did not. To try to determine what's the difference between these 2 groups of people, I looked at protein levels. Why protein levels? Well, proteins are small molecules that are inside each of the cells that make up your body. They perform various functions, and their level is highly regulated. When this regulation fails is when cancer can occur. By looking at protein levels inside cancer cells, we get a snapshot of how they're actually functioning. I found that between my 2 groups of patients, there were, in fact, different protein levels. This is really exciting because it means we can use this information to predict which patients will get a recurrence at the time of their diagnosis. This will improve colorectal cancer survival rates. And in the future, my research will help do this. Thank you.